People often ask, what is the difference between LASIK and PRK? Well, PRK stands for photorefractive keratectomy, and it's a term that came from the 1990s when a very popular procedure was going around called radial keratotomy. These were cuts that were made in a radial fashion to flatten the center part of the cornea and improve vision. It was very popular before lasers replaced this procedure. So to sound like RK, surgeons invented the name photorefractive keratectomy, which basically means we're using a laser to reshape your cornea, evaporate a bit of the cornea away to change the front shape of the cornea to get rid of your prescription power. So in photorefractive keratectomy, or PRK, we remove the skin surface from the front of your cornea. Generally speaking, with a little alcohol on the front surface, it's painless, and we laser right on the surface of your eye. So we use the entire width of your cornea instead of treating underneath the cornea as we do with LASIK. So now you need 3 to 4 days to heal the skin back onto the front surface. And from then on, the vision should be approximately what it was within hours of the LASIK procedure. So the difference between PRK and LASIK really has to do with the flap providing a very rapid response healing effect. Your vision is going to be improved within hours of a LASIK procedure, whereas with PRK, you have to be a bit more patient. So why would we perform PRK? Well, without a flap, you can't have a flap complication. Without a flap, if you were to get struck in the eye, flap cannot be dislodged. There is no flap. So for people that are very active, folks that are involved with martial arts, perhaps police officers, people in combat, we might consider PRK. If your cornea is a little thin or your prescription extremely large, it might be safer to treat on the surface of the eye, leaving the entire cornea rather than cutting underneath the cornea where I might be reducing the amount of cornea left for you later. So PRK has many advantages, and many surgeons prefer only to do PRK. In my practice, I base it on your needs, the specific aspects of your cornea that I believe could require that PRK be a safer procedure for you. In patients that have had, for instance, previous eye surgery, we may want to do PRK rather than make a flap. Otherwise, we helped invent the laser method of creating flaps, and I do really believe that flaps are a fantastic way to quickly regain the vision that you dream about. I'm Dr. Richard Foulkes. If you have any questions about this, call my main number. It's 630-724-1400, or go to our very informative website, www.glassesfree.com. And remember, there's no charge for your initial consultation.